Difference between AML and CML. Acute myeloid leukemia, AML, and chronic myeloid leukemia, CML, are two distinct forms of leukemia, a group of blood cancers that affect the bone marrow and blood cells. While both conditions involve abnormalities in myeloid cells, they differ significantly in terms of their characteristics, progression, and treatment approaches. We will explore the key differences between AML and CML. AML, Acute Myeloid Leukemia, 1. Characteristics. Acute, AML is an acute leukemia, meaning it progresses rapidly. It is characterized by the overproduction of immature white blood cells, myeloblasts, that do not function properly. These abnormal cells crowd out healthy blood cells in the bone marrow. 2. Symptoms. Abrupt onset. AML often presents with abrupt and severe symptoms, including fatigue, easy bruising, frequent infections, and unexplained weight loss, bleeding. Due to a lack of normal platelets, AML patients may experience bleeding tendencies, such as nosebleeds and gum bleeding. 3. Diagnosis. Blood and bone marrow tests. AML is diagnosed through blood tests that reveal abnormal cell counts and a bone marrow biopsy that confirms the presence of immature myeloblasts. 4. Treatment. Chemotherapy. Treatment for AML usually involves aggressive chemotherapy to eliminate the cancerous cells. Stem cell transplantation may also be considered for eligible patients. CML, Chronic Myeloid Leukemia. 1. Characteristics. Chronic CML is a chronic leukemia, which means it progresses slowly over time. It is characterized by the overproduction of mature and immature granulocytes, a type of white blood cell. 2. Symptoms. Often asymptomatic in the early stages, CML patients may be asymptomatic or have mild symptoms such as fatigue, abdominal discomfort, and an enlarged spleen. 3. Diagnosis. Philadelphia chromosome CML is associated with a genetic abnormality known as the Philadelphia chromosome, PH chromosome. This genetic marker is found in the majority of CML cases and is a key diagnostic factor. 4. Treatment. Targeted therapy. CML treatment has been revolutionized by the development of targeted therapies, such as tyrosine kinase inhibitors, TKIs, like imatinib, Gleevec. These medications specifically target the genetic abnormalities responsible for CML, helping to control the disease and extend survival. Conclusion. In summary, AML and CML are two distinct types of leukemia with different characteristics and treatment approaches. AML is an acute leukemia characterized by rapidly progressing myeloblasts and severe symptoms, often requiring aggressive chemotherapy. In contrast, CML is a chronic leukemia characterized by the presence of the Philadelphia chromosome and is typically treated with targeted therapies that slow disease progression. Early diagnosis and appropriate treatment are critical for both AML and CML patients. If you or someone you know experiences symptoms suggestive of leukemia, such as unexplained fatigue or bleeding, it is essential to seek prompt medical attention for a proper diagnosis and treatment plan.